Ahlan. Good evening, everyone. I am Ajlan Alshehri. I will be later today for the session. It is a pleasure to introduce our speaker for today, Mr. Ajlan Alshehri is a healthcare simulation specialist at King Fahd Medical City in Riyadh. He holds a master's degree in medical education, also master's degree in health and hospital administration. Shares his expertise on the topic of OSCE concept, planning, and conduction. Welcome, Mr. Ajlan.
Thank you very much for this introduction. And thank you for the audience to be with us today. Our topic today is about OSCE. Just a brief about myself. Ajlan Alshehri. I have a bachelor degree in radiology. I have a master degree in health and hospital administration and master in medical education. I obtained my medical education from Dundee University, and this is a well-known person. He's the OSCE, the one who's actually implement first OSCE, Dr. Ronald. And this is part of the Nine Wells Hospital, which is in the University of Dundee. I'm working now at King Fahd Medical City in Crescent, in the Riyadh second health cluster. As my presentation is obvious for you all.
Your presentation ظاهر.
Okay. How can I make the presentation show to me in the Zoom? Okay. So, objective structured clinical examination, OSCE, concept, development, and conduction. So we will have a small game now. Could you please scan this barcode? And give like no more than 3 words about the OSCE. What is OSCE?
Actually, we cannot see the code.
Presentation?
No, the presentation, it's a present, but the code, it's not.
The code is not obvious? Now, can you see the barcode?
Yes.
Okay, 30 seconds, and then we'll ما شاء الله. Can you see the page also now?
والله ما نرى. والله ما.
Okay, thank you very much. Well done. Most of you actually wrote something about objective structured clinical examination, exam at clinical setting, practice skills, exam objectives, and so on, type of exam. Well done. So we will proceed. So let us first talk about the assessment. Assessment in medical education. It's referred to the process of evaluating. Yes?
We don't see the screen.
What about now?
Yes, great.
So assessment, it's referred to the process of evaluating or measuring a person or things, ability, qualities, or performance. It can be used to determine the level of knowledge, understanding, or skills in particular area, or to make judgment about someone or something. And assessment is linked very much to the learning outcome and also to the teaching method during in the curriculum. So there is types of assessment, like, for example, diagnostic assessment, formative assessment, and summative assessment. The diagnostic assessment is to learn. So in the first of the curriculum, first of introducing a course or subject, the faculty will start by giving exam just to identify the ability and capability of the learners. The formative is usually done during the course or during delivering the subject, and it's give feedback and information during the instructional process. It's measure the learner progress, identify areas that may need improvement, and determine the teaching effectiveness. And the last one, it's the summative assessment. And it's actually to measure how much the learner gained of information. The summative assessment, it's at the end of any subject or course. It's provide feedback, and it's judgmental assessment. Example for the summative exam is the high stake exam, final examination, and for the formative assessment, we have like observations, homework, reflection. This is due to the during the course. The diagnostic, as we said before, it's the like a pre-test, self-assessment, or just interview before the course.
معلش دكتور عجلان ما قاطعك بس السلايد ما يمشي.
لسه باقي احنا في التايبس اوف اسسمنت. واضحة عندكم هذه ولا؟ type of
واضح.
assessment.
طيب.
طيب. Shall I continue? طيب. Objective Structured Clinical Examination OSCE. Before the performance assessment used to involve long and short case examination. It's just sorry for so performance assessment used to involve long and short case examination. ما ادري اذا كان السلايدات واضحة جدا وكبيرة ولا لا. Okay. So it's introduced instead of long and short cases examinations. OSCE is a tool for evaluating candidates' performance based on standardized scoring methods and objective assessment by trained assessors. It also evaluates performance in a simulated environments at the level of show how according to Miller pyramids of assessment. OSCE should be used in conjunction with other assessment methods in a structured assessment program, which is based on the blueprinting. A well-structured OSCE can enhance learning and have a positive impact on education. Next. So as I mentioned that this is Ronald Harden. He's the first OSCE was conducted by him in 1972 at the University of Dundee, and OSCE was first described by Dr. Harden in 1975. OSCE is a stand for Objective Structured Clinical Examination, and it's an approach to the كده إن شاء الله أنها واضحة أفضل. طيب, as we mentioned that the OSCE is an approach to the assessment of clinical competence in which the components of competencies are assessed in a planned and structured way with attention being paid to the objectivity of the examination. This is by Harden in 1975. So what is the purpose of OSCE? Why OSCE? Why do we use OSCE more than other methods. The OSCE actually, it's uniformly and objectively test the clinical competence of learner. It's assess the extent of each learner's achievement in the practical skills. It's provide and it's improve the objectivity and reliability of clinical assessment. It's evaluate a set of predetermined clinical competencies and reduce the variability in both patient and examiner. So here the pros and cons of the assessment of the OSCE. So as we mentioned before, it's objective, it's authentic, it's reliable and valid. It's provide feedback in formative assessment and evaluate in real time, overcomes bias. It's based on a curriculum, so it's cover most of the objectives. And about the cons, it's very costly and it's time consuming. It's required a large space and a lot of manpower, as well as examiners, administrator, coordinators, and so on. When to use OSCE as assessment method? Actually, Miller have developed this pyramids to show the best way of using the assessment. For example, the facts that need only recalling for the knowledge. The best is to have the assessment by applying MCQs, and which about if the skills need to be just recalled and understood. The lower part of the pyramids, it's usually those people who are novice, so they need to know basic information and basic knowledge. The upper level is knows how, which a little bit more than just recalling. It's interpretation and it's analysis of data that the learner have. And this can be presented by case presentation or essays. Our concern and or our interest is about shows how, which is the application of what have been learned in a controlled area, such as in simulation labs. And this can be here done the OSCEs. The upper one, which is usually in practical or in clinical sites, and it's been measured by direct observation from the clinician or using workplace-based assessment. What OSCE can assess? OSCE can assess communication skills, clinical history taking, physical examination, practical and technical skills, clinical reasoning skills, interpretation of findings, clinical decision making. طيب, development of OSCE. So there is a component of OSCE. There is stakeholders, which is about committees, examiners, simulated patient, examinees, and supporting staff. Also, the station, which is about preparing the station. Each station should have aim, scenario on the questions of this scenario, and the tool that will be used to measure the competence of the learner. It should have also time, allocated time. And also we have here simulation setup, which is about the equipment simulator and the environment as general. The last one, which is about the logistics, it's about paperwork, time, signal, signs, and location, reservation of the center, and emergency plan just in case. So building OSCE station, it's should go through many steps, starting from the objectives and defining these objectives. And as we see, every time you will see that objectives is the main base for the curriculum, the assessment, the evaluation. So it's very important to be defined very well and know what you have to measure. So determine the specific clinical skills or competencies to be assessed. Design stations, which is about creating a detailed plan for each OSCE station, including a clinical scenario, tasks, and assessment criteria. Developing scenario, it's should be the scenario should be realistic and should include medical history. If there is like a physical examination or findings, it should be included, and the required task, which is about the questions. What would you like to answer? Recruit standardized patient if there is like a communication, or you need a standardized patient to be part of this station. You need to train this SP to portray the scenario consistently. The preparation of material, develop and prepare any material needed for the stations, such as chart, probes, or equipment, simulators, anything that's need to be prepared for this station. Train the examiners, and this is very critical for the reliability. Provide a training for the examiners on how to evaluate learners' performance and use assessment, and how to use the assessment tool. Set up for the examination area, organize the physical layout of the exam stations, and ensure all materials and equipment are in place. So during the exam, you will not be disturbed by asking for things that is not with you ready with you in the center. You can actually conduct a pilot test just to make sure that everything you need is in place. And to make sure that the OSCE is valid and reliable, we just need to know what is the validity and what is the reliability. Can somebody share with me what he understand by validity and what he understand by reliability? Can somebody answer, or shall I continue?
Reliability is about the instrument how it's measure the same output, give the same output on different time, and validity to use the correct instrument to measure the output.
Thank you. So the as mentioned by the guest, the validity is the consistency, and the reliability is the validity. I mean, it's measure what it's supposed to measure, and the reliability is the consistency of the exam. And this is just to show you. Do you see the presentation?
We see it, but can you make it full screen?
Full screen, okay. الآن كيف؟
It need more.
كده؟
Yes, it's better.
Okay.
There is a comment according to your question. Fatma said, reliability and validity are both about how will a method measure something. And Munira say validity mean accuracy, and reliability it's mean quality.
Thank you very much for them. As we mentioned before, just reliability is about consistency. So every time we do the exam, we can get the same result. And the validity, it's about the credibility of the exam, and it's measure what we would like to measure. So, for example, you can see here, it's the black spots in the first image in the it's an you can see many black dots. It's distributed on the above the central line, and it's, as you see, it's unreliable and it's not valid because it's not distributed. For example, the validation, that means it's cover all the curriculum, but here, as you see, that's most of the dots, it's above it's one in one hemisphere. The second image on the right, it's said it's unreliable but valid. Valid because it's distributed and it's covered the whole curriculum, but unreliable because it's not consistent in the result. The down in the left side of me, maybe you're in the right side, it's reliable. It's mentioned here, it's reliable but not valid. So not valid because, as we mentioned, that it's not measuring the whole things, but it's consistent because it's spotting in one area. The validity and reliability, as you see in the right one down, it's covering the curriculum, and it's consistent in the middle. And we have like a steps that we can use just to make sure that we are using a valid and reliable method. First, we should designing the OSCE blueprint. So most of the curriculums actually have developed a blueprint that from beginning aligned with the objectives, and each method should be like comprehensive and should be concise on one objectives or more. So consistency on the reflection of the curriculum is giving the reliability more, and minimize the overlap in station content. So each station will measure one or maximum two objectives. Also, the validity, because the validity, it's about covering the relevant clinical skills. Face validity and content validity is very important here. Ensure that content validity is reflecting the required competencies. The second step is standardizing the stations. So unify the tasks and trained standardized patient and equipment across all stations that have the same clinical skills. Also, trained examiners is very critical for reliability in standardizing the stations. For the validity, the station reflect a real clinical situation, and the scenario actually it's cover different complexity of the clinical site. Training examiners, as we mentioned before, it's very critical. Inter-rater reliability should be improved by train the examiners. The examiners should have also expertise in this area. So this is very effective in the examination. I cannot bring, for example, one of the medical laboratory to examine somebody in radiology in the X-ray, about X-ray. If there is an exam and there is like an X-ray and the medical laboratory, he's not the one who should examine the learner in this station. Even if he gets the training, to make this station valid. Use structured marking schemes. So detail rubrics reduce the subjectivity and maintain the consistency. Also, and the validity, measure intended competencies such as clinical reasoning, and this will increase the construct validity. You can do like pilot testing just to identify this reliability and validity, and to ensure that all the stations is reflecting the content and it's consistent in the results. Of course, after the exam is done, there will be statistical analysis. In the reliability, you can use Cronbach alpha and inter-rater reliability coefficient to check the consistency. And for the validity, you can measure the ensures that construct validity and distinction between performance level of the learner. Feedback and iterative improvement. Feedback is important from the examiners, from the standardized patient, and from the learner as well. So this will improve the realism of the clinical exam, and also make it more relevant to their specialty. Multiple forms and the longitudinal analysis. So doing many OSCEs for duplicate this OSCE many times this can you can ensure the reliability by doing test and retest, and this will give you a good insight evaluation for the consistency of the exam. So actually, the good station is depend on the a good checklist. So there is a steps that and this is I just propose this one. Actually, there is a many ways to or steps that can be founded in the internet. This one of it actually. First, the steps should be in sequence. You can break it to small steps and mark based on the importance, and validate this checklist. Open to suggestion and feedback. Validation here, that means you will give it to some expertise to give you feedback about this checklist, and maybe you can do a pilot after that. Marking schemes, a detailed guide used to evaluate and grade performance. The primary purpose of marking scheme is to ensure consistency, fairness, and transparency in the evaluation process. So, key elements of marking schemes: criteria, specific aspect of the work being assessed. This could include the knowledge, understanding, application, and analysis. Descriptors, there should be a description of the different performance level. For example, make it excellent, good, satisfactory, needs improvement, and so on. Scoring system, assigned numerical values or grades. Weighting the relative importance of each criterion or section. Feedback, notes on the performance which can help learners understand their strength and area for improvement. And here an example for a checklist, basic life support BLS. Here, for example, here some steps: ensure safety, check responsiveness, and the grade is on the right column. So if he met the criteria, we'll give him 1. If he does not met, we will give him 0. And we can give comments about the learner performance to help the learners improve in the next exam. So also all of this, what we have said up to now is about making this OSCE valid and reliable, is also making sure that there is clear instructions for the candidates. So the candidate should know when he should be there in the exam area, and what he should wear, also what he shouldn't do, and what he should do. It should be clear. Also, some instructions should be to the simulated patient. Should know what is the medical history, the symptoms, the emotions, and expected responses. Also, one important thing that I would like to mention is about that simulated patient can give feedback on the communication skills and professionalism. and the learner can actually learn from the SP, especially if the SP is expertise in the area, or he had like a good background about the task. Instruction also to the examiner or the instructors so he should be familiarized himself with the evaluation criteria and the marking, and also about the task that he should do. Also, maybe he's prevented to talk to the learner about or give him like a hint or something. However, if this is allowed, there is no harm. Now we prepared everything. We have like stations ready. We build a scenario. We build a checklist. We make sure that is valid and reliable. We give the instructions to the learner, to the instructor, to the SP. Now we are ready to implement our OSCE. So there is something before the conduction, which about some questions that the assessment specialist should ask the committee organizer or the committee head about it. For example, number of stations. He should ask how many stations you would like to implement, the time for each station, and the time that's needed to be to transfer or to just move from the one station to another, and how many learners are there to make sure that the planning will go in perfect way. The successful implementation, as we mentioned before, a good and excellent setup. So arrange station in a clear sequential path with enough space and resources. So the area should not be so much crowded. Each learner should stand just beside the door or the area that he need to enter it, and make the motion on this inside the area very smooth, and the personnel should help on this. Time management. So you can set a fixed time per station, from 5 to 15 minutes. This could be enough for each station, and make it like equal time to allow the learners to move from one station to another. If there is one station have more time, for example, one is have 5 minutes and the other is have 10 minutes, there will be like a miss in the sequencing. Movement flow. Learners start at different station and move in order without overlap. As we mentioned before, that the number of station, for example, if we have 4 station, we can put like 4 learners in front of each station, and then they have to circulate in like rounded shape. The simulated patient and examiners should stay at assigned station with scheduled breaks as needed. So make sure that break for the simulated patient and the examiners to have a rest, to drink something, and to go back to their station. It should be in the schedule, and it should be informed to this schedule should be circulated with the stakeholders. Handling delay, this is one of the challenges that may happen in the during OSCE. So you should have a backup plans for these delays and assign a coordinator to manage the flow. Especially in if there is like a huge number of learners and and many stations. For example, in our center we have like 12 stations, and there is a lot of also learners. For example, from family medicine we run about 180 learners, and we alhamdulillah we succeed to manage the flow of this large group with good coordination and good assignments for the coordinators and the examiners, standardized patient, and the support team from the simulation center. Communication is critical for the OSCE. Use bells or announcement to signal station when it is start and when it's end. This will help the learner actually to know when they will finish, when they will start in the station, and when they should leave the station. So you can give like a brief before starting the exam. Just give a brief to the learners what they have, what they suspect to have in the examination area. So we will say that, for example, when you hear the first ring, that means you can enter the station, and when you heard the second bell, that means you have to leave the station, and so on. This is an example, as I mentioned before. This is for learners, and they are distributed in 4 stations, and each one of them, when the time is finished, the ring will come up, and they will move from one to another. So the one who's in the station 1 will move to station 2, and the one who's in station 2 will move to station 3, and so on, until they finish the OSCE. So here is a question. It's not about testing your knowledge. It's just making this part of like funny things and enjoyable moments. This question said you have 32 learners, 8 stations were developed. Each station have 7 minutes and 1 minute for transition. So how many rounds do you need, and how much time do you need to complete this exam? I don't know if we have much time or because I have just one slide. So we need your answer, please. There is no it's just about exercising. It's not about right or wrong.
4 minutes or 4 rounds, sorry.
4 rounds. Okay. I think most of you maybe answer it. Yes, thank you very much. All right. So thank you very much. most of you actually answer the question how many rounds. It's four rounds, and how much time. I'll leave it for you just to exercise and do it as a homework for you. We will go to the last slides, which is about the confidentiality, security, and legal ethics compliance. So keep all simulated patient informed and learners result private. So everything should be kept confidential till the simulated patients, since they are not mostly not part of the examiners or the committee. So it's very important to also inform anyone involved in this OSCE exam, to make the everything confidential, even the exam itself. If you would like to give feedback, try to make it individual, just to make it more acceptable from the learners. And also do not ask the learner not to discuss the exam after it finish. The security, the exam area should be restricted, and the personnel during the exam should keep the learners and move them in a way that make the exam secured from any breaching. Ensure also about ethics. Ensure all participants follow the ethical guidelines to protect the exam integrity. So this is all what I have. If you have questions, you can post it or ask it now. I don't know if we have time, but I think we are almost 8. Thank you very much. Thank you, Ala. Yes. Yes, exactly, Dua. For one round is 64 minutes. Yes, for one round. So it will be 4 rounds, so multiplied by 4. You're welcome, Iman. Thank you, Ghada. Appreciate Munira. Dr. Samah, thank you. You're welcome, no problem at all. We'll see, Dr. Samah, about the slides. We'll see, inshallah. Don't worry. It will be maybe recorded. This one is recorded, and it will be posted in the Jam'iyya, Saudi Society for Simulation. No worries, Dr. Samah. Thank you, Dark 1, Dark 2. Yeah. No worries. Thank you very much. Thank you, Hala. Thank you, Hala. You're welcome, Dr. Adan. Thank you, Asil. Okay, Joyce, thank you very much. You're welcome. No worries. Appreciate. Paul, thank you. You are most welcome, Paul. Welcome, Sumaya, no worries. There's one question from Sumaya. She said, I would like to know if multidisciplinary team can join to evaluate. Actually, there is no, thank you, Adil, appreciate it. There is no like 100% answer. It's depends on the task and their expertise in this task. If they are doing, for example, if we said like family medicine and doing family medicine physician and doing like inserting tube, for example, and the best one who's doing this actually maybe is the nurse. But the diagnosis and the prognosis maybe is the physician is the one who can give full knowledge about this one and good practice also. But informative, if it is like formative assessment, my opinion, it's okay. It's about resources anyway. If you don't have enough resources, you can like ask other disciplinary to join you and make the assessment. I hope that I answered you, Sumaya. Right, Dr. Uhud Al-Rashid, thank you very much for moderating this session. And stay with us, guys. We will have the opening ceremony for the SIM week, inshallah. At what time, Dr. Ahud?
ايوه اهلا يعطيك العافيه استاذ عجلان صراحه معلومات جدا قيمه واشكرك عليها حقيقه شكرا يعطيك العافيه
العفو، الله يعطيك العافيه. شكرا لك وشكرا للزملاء اللي كانوا معنا هنا، شكرا لهم جميعا صراحه.
Please wait for the other Zoom meeting. I will share the link to participate. Please wait.
So Miss Ala said the opening ceremony will be at 8:30. Be with us, inshallah. Assalamu alaikum.